Hi, yes. So this is just a continuation of my previous video where I was speaking to someone in the medical field. The person's actually a friend of mine. I respect them a lot. And she's into, I think, veterinary sciences, so it's the medical field. And she did say, I think the wording was, my dad was a type 1 and now he's a type 2, so you'll be fine. Oh, please stop telling type 1s we'll be fine, or saying, I can't wait for you to get off insulin. You're literally telling me you can't wait for me to, because that's the only way I'm gonna get off insulin. And so I was correcting them. I'm like, your dad was never a type 1 diabetic, because if your dad was a type 1 diabetic, your dad would still be on insulin today. And the person's response, of course, there was this pushback, and she was like, I've studied biology intensively, and I understand the pushback. I do understand it. And it's because this person has heard from medical personnel. This person has heard from a nurse. This person has heard from a doctor that for 40 years, this person has had this knowledge that your dad was a type 1. And now the dad is no longer on insulin, and the dad is on oral medication. It's hard for you, as someone who, is just a nobody with type 1, telling this person the diagnosis that you've known for 40 years in your family was wrong. But I was right, because if the dad was a type 1 and now a type 2, the dad would be the only person in the world who's ever been cured of type 1 diabetes without some sort of invasive surgery. And we're talking about a pancreas, like, transplant. And even that is not perfect. People don't want to do pancreas transplants, because then you have to be on immune suppressants for the rest of your life, because your body will definitely reject someone else's organ. So people who undergo organ transplant have to be on that immune suppressant medication. And what that means is that you're on medication that kind of suppresses your immune system to not work as well as it should, in order for it to not be overactive and attack all these other people's organs or anything that you're putting inside your body. But that puts you at, and I mean, I'm not a doctor, but that puts you at a higher risk of dying from something as simple as the common cold, because your immune system is now suppressed. And when you get the common cold, usually your immune system will attack that, and that keeps you alive. And now it's just weakened and it's not attacking anything. And so it really depends. I mean, are you going to switch that up for a new pancreas and not have type 1? I don't think it's worth it. I don't want to undergo an insulin. I don't want to undergo like a pancreas transplant. So yes, I think that's all I wanted to say with regards to the difference. So please just know the difference. Stop telling people it's gonna be okay. Rule of thumb, whoever you meet and they say they have diabetes, too, because 99% of the chances are you're right, it is type 2. Just because somebody is overweight, don't assume that they're a type 2, because type 1s do gain weight. I'm not sure people knew me before I was like 40. When I was diagnosed, okay, I'm gonna make a video talking about the symptoms, which is weight loss. But my normal weight without getting sick or anything was around 55 kilograms, and now I'm like 65 to 70 kilograms. So let me just show you um just my body right now. I'm not sure you can see it, but I'm a little bit like different from, I'm generally bigger than what I'm used to. um but yeah, I think I'm a healthy weight. I still need to exercise, just to tone things up. But yeah, I am a type 1 diabetic. It's different from type 2. I'm a big advocate to have these diseases have different names completely. They shouldn't be named type 1 diabetes and type 2 diabetes, because I think that's where the confusion comes in. where people are like, oh, it's the same thing, just one is type 1 and one type 2. It's not the same thing. There's a lifestyle there's a lifestyle illness that can get better, that can get into remission. You can live without insulin, you can live without medication for this one. And then there's another one, which is an autoimmune illness, which means that you're stuck on insulin for the rest of your life, no matter how healthy you are, no matter your lifestyle, your diet, you're going to be on insulin for the rest of your life until there's this cure that they've been talking about for so many years now. Every time we read these articles about cures, we're just like, oh, well, good for the rats that they're getting cured, but the humans are not, yeah, and that's what, let me see if there's anything else that I missed here. Yeah, and please, guys, can you just stop with the stigma I know I'm not a type 2, but just stop with the stigma and shaming type 2s. I've heard it a lot, and I see it a lot online. Oh, you're so fat. Oh, you're doing this. Oh, you're gonna get diabetes. And I can imagine if it makes me feel bad and I'm a type 1, because I know people don't really understand the difference between type 1 and type 2s. But I can imagine if I were a type 2, I don't want type 2s to be ashamed of what they have. They still need support. It's still a very deadly illness. In South Africa, just diabetes in general, the stats at the moment stand at, I think, every hour 3 diabetics are dying. So it is a serious illness, and no one should be shamed for it. Everybody needs our support, no matter whether they're type 1 or type 2. But just remember, if you meet someone, they're probably a type 2, and stop telling people you'll get better, you'll stop insulin, because that's not possible if you're a type 1. Yeah, so I hope this educated somebody. I hope this helps somebody out there. I hope this helps with to reduce the stigma. Even if this video just touches one person, that's enough for me, that one person knows not to do this. And and yeah, just get tested. If a hospital tells you, oh, you're on insulin, you're a type 1, get tested. There are tests. There are hospitals, bigger hospitals, I think, like Steve Biko in Pretoria West, can do it. I know that Edenvale Hospital has an endocrinologist department. I know that George Mokare, although the admin there can be questionable, they can run the test for you to determine that you indeed are type 1. Type 2s, they really feel like they don't even need that test for confirmation. Type 1s, you need that test, because there's a certain way that you need to be treated. If you're a type 1, your treatment is very different from a type 2. Yeah, and I'll go into that with other videos, but for now, just be kind to each other. Be kind to diabetics. It's not an easy illness. We do get okay. You know what? I'll talk about this in another video. Just the symptoms and everything, and yeah, I just hope I've educated somebody today. So thank you very much for listening, and I'm done.